Talk of the town in scientific research. Key points from Microplastics and Nanoplastics in Atheromas and Cardiovascular Events. Plastics in human body. Plastics are everywhere in our daily lives, from water bottles to clothes and cosmetics. Once they get into the environment, they degrade into microplastics, which are particles smaller than 5 millimeters, or nanoplastics, which are particles smaller than 1,000 nanometers. Several studies have found these plastics in various parts of the human body, including the liver, lungs, breast milk, urine, and blood. These particles enter our bodies when we inhale or eat food contaminated with plastics. Microplastics linked to severe health risks. Reasons to be alarmed. A new study published in the New England Journal of Medicine in March 2024 has an interesting finding. The study involved 304 patients who had no symptoms but needed to have surgery on the artery of the neck, called an endarterectomy. During these surgeries, doctors took out samples of the plaque, a kind of gunk that builds up in the arteries. Interestingly, they found microplastics in the plaque sample when they looked closely at this plaque using advanced tools like chromatography and electron microscopy. 150 patients out of 304 were found to have fragments of polyethylene and polyvinyl chloride in their plaque. These two forms of plastics are the same plastic commonly found in grocery bags, bottles, food packaging, flooring, and pipes. The scientists then tracked the patients to see if these microplastics could tell them something more about the patient's health. Among 304 patients, 257 completed the follow-up period of around 34 months, and the results were shocking. They found that patients with these microplastics in their plaque were 4.5 times more likely to have serious health problems, like heart attacks, stroke, or even die within 34 months after surgery compared to patients who did not have these microplastics in their plaque. Limitations of the study. This was an observational study, meaning the study cannot prove the cause and effect directly. The number of populations was small, creating a possibility of exaggerating the risk and inability to represent the general population. Previously, we have seen studies that air pollution affects our hearts. Plastics might have a similar impact, but we can't be sure if they directly cause heart problems. The patient's details, income, education, and feeding habits were not explored in this study, which could affect their heart health. Key takeaways. Microplastic found in the neck artery increases the risk of heart attacks and strokes. Interestingly, the researchers also found more plastic in people with diabetes and cardiovascular disease. This raises many questions that are yet to be answered, such as why microplastics were more common in these participants and whether there may be a correlation between other diseases and the presence of microplastics in the body. These findings suggest that plastic pollution might play a role in heart disease. This calls for more research and ways to reduce plastic exposure to protect our health. The full article is available at nejm.org.